thank you first off for inviting me. My name is Itamar Megiddo. I'm a professor at the University of Strathclyde these days. Before here, I was at the Center for Disease Dynamics, Economics, and Policy in Washington, DC. And I do work on health systems modeling, disease modeling, a lot of work in agent-based simulation, which is what this talk is about, but also in a few other areas, working on antimicrobial resistance, working on various infectious diseases as well as non-communicable diseases in global health, as well as in the UK and in the US specifically. So today I'm going to be talking about agent-based modeling, and it's going to be an intro and some examples from IndiaSim and a care home model, not a care home modeling, which is what it says over there. If you have questions, you can see my email at the bottom of the screen here, so you can email over there. If I look to the left sometimes, that's because my Zoom screen's on the left, so that's why I might be looking to the left a few times. So, all right, so outline for today, what we're going to be talking about. So we're going to have a quick example where an ABM is useful for modeling complex systems. So we're going to be talking a bit about what a complex system is to understand when agent-based models are going to be useful. Then I'm going to define, since I heard that a lot of you are interested in working on agent-based modeling, some of you might have some experience, some of you might have less experience. So we're going to define, for those of us that have a bit less experience, what agent-based modeling is. Then we'll talk a bit about why and some of how an agent-based model is developed, using examples, including the background objectives and advantages of agent-based modeling. I'm not going to talk so much about disadvantages, since this is based off of some of my intro to agent-based modeling class, plus some seminars that I gave both at the Center for Health Economics at York and at the UK Department of Health and Social Care, which was a longer seminar. So it was like a 3-hour seminar, or one of them was 2 hours, one of them was like 3 hours. So I had to cut some stuff out. So I won't talk so much about disadvantages. Then we'll quickly chat a bit about the how to develop agent-based models. I'll tell you a little bit about what tools I like to use, or what are some other options, how you might go about developing a conceptual model and implementing a model. I won't go into detail for that. If you are interested in going into detail about that, so we do have a class here that I teach on agent-based modeling as well. That class covers both agent-based modeling and Bayesian belief net modeling as well. And it's part of a new MSc that we have in health analysis, policy, and management. And it's also part of a data analytics model that we have, data analytics MSc that we have as well. So if you're interested in more detail into how you can explore that, there's a link there to that. Then I'll go through a few quick examples of results from one of those models. I'm not going to go too deep into that again because of time restrictions. And I'll wrap it up before giving you some time to ask questions and answers. So the plan is for me to talk for about an hour and then have some questions and answers. If you have questions in the middle, feel free to try to stop me. Maybe you can let me know, even just, I might not see your hand raised, so you can just interrupt me by talking, because with the Zoom screen, it's a bit difficult to see here if someone made a comment in text, I might not see it since it's on my other screen to the left here. So you can just interrupt me if you have a question in the middle to try to get some more clarity about something. So starting off, a quick example of where an agent-based model is useful for modeling complex system. And we're going to go into a completely different world from health, which is the world of health and healthcare systems, is where I work in mostly. And that example comes from complex systems in nature. So I'm not going to put up this video here, but you may have seen videos along this line, or you may have seen it yourselves. If you're walking outside, you may have seen starlings or other types of birds creating these really amazing flocks and moving together in certain directions and forming these really beautiful shapes and patterns. Now, it turns out that these complex systems are things that we can model bottom up, right? So if we understand the behavior of individual birds, then we can understand how the whole group would move together. There's not one leader here that decides where all the birds move together, right? That's the idea behind complex system. There's not necessarily one direction or one directing bird or one leader or some global optimizer that is deciding where everyone is moving. It's a lot of different components that are each making decisions based on their local information, what they perceive about their local environment, and making decisions on how they move. So in the context of these birds, for example, we can model how they move in an agent-based model to create these flocks based on 3 simple rules. Essentially, each bird takes note of the birds in its surrounding area, in close proximity, and they move at a similar speed to those birds. They move in a similar direction to the birds that are just in their very close proximity. And lastly, the last rule is while they move closely to each other, they do not crash with each other. And just by those 3 simple rules, we end up with these flocking patterns. Now, of course, there's also some external factors affecting how these patterns form overall, but generally, if you have those 3 rules, you can project how flocking of birds will occur. So the idea is pretty similar in global health or in health in general. One of the big promises of complex systems modeling, or which agent-based modeling is a part of, is if we can understand the behavior of individuals in this complex system, potentially we can make some predictions about how the whole group will behave together and what are some of the feedback loops that occur in that process. So as you might imagine, though, in that specific case, and in other cases, complex systems are difficult to predict and manage. So if we know the macro level outcomes, it is often difficult to understand the micro level mechanisms that lead to that macro level outcome. All right, so in the birds example, we knew our macro level outcomes, but still getting to the specific rules at the individual level that lead to that macro level outcome, that is something that is difficult to do. But an area where agent-based models can help us understand some more. The other direction is also something that often complex systems are often used. Complex systems modeling is often useful to understand the system. That direction is if we know the micro level mechanisms, it is difficult to predict the macro level outcomes of the system, but that is where agent-based models and other types of system simulation models are helpful. So in the example in the picture here, we have global warming, and we know some of the mechanisms at the lower level, and we might be able to use those to project what global warming will look like as we progress forward. So we can look at things from both directions. We understand the macro level behavior of our entire population that we're looking at, or entire system that we're looking at, and we want to understand what the rules at the individual level, or we can work from the individual level and try to understand how the population as a whole will behave, how that behavior emerges as a whole. So complex systems simulations, including agent-based models, can be used for different purposes, right? So agent-based models are part of complex system simulations, and they can be used to improve our understanding of systems. So to test some hypotheses about the systems, how things work in these systems. They can be used to study sensitivity and guide data collection, right? So if we, similarly to other types of modeling frameworks, we can use an agent-based model to try to understand, all right, what parameters of my model are important, and that can help us guide our data collection. One of the advantages of agent-based modeling, as we'll talk about, is that there's a huge amount of flexibility about what we include in our model. So that means we have more room to test what different data are important for our model, what different parameters and elements are important for our model, because we can incorporate more elements in our model. They can be used to project future outcomes. And by projecting future outcomes, I just mean here, try to say, like, essentially, if we were looking at projecting the weather for tomorrow or the next few days, try to understand what is happening in the future. What we focus on here in this talk, and usually when we have agent-based models for the purpose of policy analysis or evaluation of policies, is predicting outcomes in what-if scenarios. These what-if scenarios might be scenarios that might emerge in the real world, but they're not necessarily, we're not trying to project exactly what necessarily will happen in the real world, since there's a lot of factors that we'd have to take into account that we might not know today about that. But we look at a few different potential scenarios or potential application of different policies or interventions and see what outcomes might occur at the population level given those scenarios. And that's the focus of the types of agent-based models that I'm going to be talking about today. So what is an agent-based model? So this is a definition that I like. It's a bottom-up modeling approach in which the system's behavior emerges from actions and interactions of autonomous agents with each other and the environment over time. I'm going to highlight a few different elements here. These are the key elements that I consider for an agent-based model. We have a system, and that system is composed of interactions of autonomous agents with each other and with the environment. So what are agents? They are entities that are defined by their properties and characteristics, as well as sets of actions. So you can think about them as just individuals, people. They could be people in your model. Characteristics might be their age, their sex, their wealth status, their well-being status, and so forth. And sets of actions might be going to visit a healthcare facility, or treating a patient, or going to the bank, or whatever other action they might take. It might be also, we might have broader agents that are just healthcare facilities. A healthcare facility might be an agent that has its own action. We might not need to define agents at the level of individuals, but could be at the level of individual healthcare facilities, or even at the level of countries. We might have different countries that are agents in our model. In agent-based model, which is one of the unique characteristics of agent-based models, our entities are autonomous. So that means that their actions are not scripted, rather they make their own decisions. And we'll take a look in a bit at how we model those decisions and how they take their own decisions based on information they perceive about themselves as well as about their environments. They are social, so they interact with other agents in some way. And they are reactive, so they perceive their environment. And all of those, that information helps them make those autonomous decisions. The environment, so that's the other key element here, that provides our context. In the birds model the birds scenario that I showed to you of a complex system, the environment is comprised of the agents that are nearby. So they describe our environment. Also, potentially, if there are any obstacles in the way that shape how the flock is going to move, those might also present. The environment provides the context. But we can also have environments that are presented by networks, or a healthcare facility might be an environment as well. You can even find agent-based models that describe in which the agents are cells in the body, and where the environment is then the human body, and describe how potentially cancerous cells develop. And then we have the other component which I mentioned, which is interactions between those autonomous agents and the environment as well. Now, those interactions can be in forms such as dependency or competition, right? So they might depend on one another, right? So say in a supply chain model, you might depend on your supplier to then produce some sort of good, or there might be some sort of competition between different agents. And they form the relationships between the agents. And they can also be in terms of between agents and the environment. So they might not be necessarily directly just between agents. So might be, if we're talking about relationships that are direct between agents, say in an infectious disease model, it might be you come into contact with another agent and you infect that other agent. Or you go to a healthcare facility, one agent is a patient, one agent is a physician. The physician prescribes some medicine. There's some sort of contact between them, but there might also be relationships related to that are mediated by the environment. So a relationship that's mediated by the environment might be, for example, an infectious disease model, right? You might have agents that contaminate the environment, then the environment, another agents come to the same environment and then they become infected. Or if a number of different agents go to the same healthcare facility, they interact through the environment by creating a long queue in that healthcare facility. And the key for these systems is that they're bottom up. They emerge from the bottom up. All right, so there's not, emergence is the aggregate of the behavior of the complex systems. There's not top-down structure. There wasn't one bird that told all the other birds in which direction to fly. Right, so there's not one orchestrator. Rather, the system components self-organize and come together to create the population level behavior then emerges, or the system level behavior then emerges. And then the outcomes that emerge are routed back as inputs into the system, creating this feedback loop. So we might end up reaching some sort of equilibrium, but we might also never really reach an equilibrium if there are these feedback loops that work in certain directions. Just to give a very brief example of an agent-based model, what it might look like. So this is just an idea of what this is not a specific agent-based model, but an agent-based model. An example of an agent-based model of a health system might look like. We have agents. They're described by characteristics and their internal states. So those might be demographic characteristics as well as their health state. We have the environment. That might be a physical environment, so might describe it in detail, different locations. The environment is also described by interactions with other agents as well as healthcare facilities potentially in this model. Now, the agents perceive that environment, so they see what's going on in their nearby environment through sensing, and that is what is so they sense throughout what the world looks like right now. Now, based off of that information, both the information that they sense about the environment and through their own characteristics, then they make these autonomous decisions. These are often programmed or coded as condition actions, like if-then type actions. If certain characteristics, I have certain characteristics and the world looks a certain way, I will follow a specific rule. Typically, these are stochastic rules. So let's say if there's a long line at healthcare facilities and I'm only mildly sick, I might choose not to go to the healthcare facility. And we often model these stochastically. And what I mean by that is that agent might follow that rule with some probability. Now, these can be very simple if-then rules that we define ahead of time, like in the BIRDS model, or they might be also rules that are based off of machine learning algorithms or regression models. And we'll see not machine learning algorithms, but we'll see some regression modeling for some examples of these rules from one of the models that I'll be talking about. And then based off of these rules, they decide on actions that they're going to be doing. These are autonomous and proactive actuators. And these rules then, these actions then potentially change the agent's characteristics or their health states, right? It might mean they become healthy if they are less likely to have a disease. If a state is, for example, become vaccinated or not become or if the action is become vaccinated or not become vaccinated, or they might change their socioeconomic situation. And they also change the environment potentially, right? So if an agent visits a healthcare facility, that increases the line at the healthcare facility, or the supply of individuals at the healthcare facility, meaning that there's less time to see other patients or something along those lines. So that's what sort of how these different feedback loops occur. And from these interactions between agents and the environment, we have emergence. The advantage of ABM in one word would be, if I had to describe it in one word, would be flexibility. right? And that is the flexibility to explicitly model processes and phenomena without needing to rely on imperfect assumptions due to mathematical tools. So sure, we can model a lot of these systems with other types of modeling methodologies, say, for example, system dynamics, or if you're in the world of infectious disease modeling, compartmental models. But we are restricted there by the mathematical tools we have. With agent-based models, since these are rule-based, and we code these rules typically we program these rules in coding language, there's not really a limitation on the types of rules that we might have. So we're not limited by the mathematical tools that we have. We may still be limited by factors such as our knowledge of what the system looks like or how different agents behave, or by data availability or computing power potentially still, but we're not limited by the tool's mathematical assumptions. That flexibility can also cause problems. You don't want to have a complex model just for the sake of having complexity and representing reality as closely as possible. Often the idea behind modeling is to abstract to some extent from the real world. So we don't want to have a complex model just for the sake of it being complex. It will make it far harder to understand what's going on within our model. And if we don't understand what's going on within our model, it's far harder to interpret the decision rules that it suggests we should follow, or the advice that it suggests. So generally speaking, good advice is to start simple and incrementally introduce complexity. So examples of agent-based models and the flexibility to simultaneously model the environment, behavior, heterogeneity, and various other factors. So I'm going to use a couple examples as we go through some of these advantages. One of them is IndiaSim, which is a project that I have not worked in the past 2.5 years or so. It's a project that was part of DCP3, the Disease Control Priorities 3, which I worked on when I was part of the Center for Disease Dynamics, Economics, and Policy in Washington, DC, and is a Bill and Melinda Gates Foundation funded project that published 9 volumes that was published through the World Bank. And IndiaSim was a part of that project and was used to model the Indian healthcare system and its interaction, and the interaction of the Indian population with the healthcare system. And the other one that I'll talk about is COVID-19 in care homes, which is work that we've been doing over the past 1.5 years and continue to do. Originally, it was work with local health boards over here advising the Scottish government. By the way, University of Strathclyde is in Scotland, if you were not aware of that. Since then, we've also been, since December of 2020, we've also been advising SAGE social care working group. So that's the SAGE is the scientific advisory group for emergencies in the UK. So the social care working group is the group that is working on care homes and elderly populations, as well as other populations with special needs. So we've been advising them as well. So we're going to go through some examples of advantages of agent-based modeling and their flexibility, and one of them is modeling the environment. There's a lot of different options of how we might model the environment, and we're not limited here by the mathematical tools. If we have data to the level of GIS data, we can model the environment to that level and specifically describe where our agents are. We might have a patch style model in which each patch represents some sort of area and agents move between those area, or we might have network type models, which is what we see on the rightmost on my screen here. And that example is a network of different hospitals. Looking at the COVID in care homes model that we have, our environment is obviously a care home here, but we have different, we look at different types of care homes, including how they're structured in terms of their different units within the care homes, how different staff work in different units and how those different units are connected with each other, different sizes. But all of these factors provide the context of our model, or the context of for these agents in which they interact. The environment is also described by the different agents that other agents interact with within that model. In the case of IndiaSim, so that's the other model. So I'm going to flip a bit between the two different models for these different examples. Our environment describes rural and urban Indian populations and parts of the health system at the district level. So we're describing essentially the entire country. We have patches here. So this is a patch-based model. And each patch describes either an urban or a rural patch, or a rural patch and these are at the district level. Depending on which. In some cases, we look at things at district level, and some models where we abstract from the district level and go up to the state level, depending on the specifics of the model, because we have, it depends on what's important for our specific model. We always, generally speaking, you always want to construct your model depending on the specifics of your question. So at the lowest level, we go down to the district level. Each one of these patches has healthcare facilities, which also describe our environment. And these healthcare facilities might have different levels of quality, and they might have different populations that they serve. And each one of these patches also house households. So all these things describe our environment in IndiaSim. The data that this is based on, these healthcare facilities and households are based on, is in part DLHS, so the district level household survey, as well as the national sample survey as well, India National Sample Survey. Going into another advantage of agent-based models in terms of its flexibility is the flexibility to describe heterogeneous populations. So often in other types of model, we group all of our populations into a few groups where we have all of our population describing by a few factors, or a few groups with each group having a few factors describing that population. With agent-based model, we can describe the population completely heterogeneously, whether that population is humans or healthcare facilities or whatever that population is, including by any factor that we look at. It could be biological factors, so we could also describe our population, say by, if we have a model for diabetes that's looking at diabetes, say, we can look at, have a distribution for our population that describes the blood pressure of that population, while also describing different demographics, while also describing different behaviors of different parts of the population, while also these population might have different historical experiences. Historical experiences is really something that is difficult to model in other types of modeling, equation-based models and other types of simulation models. The idea that entities within the model, the agents, remember what they've done in the past, that might influence their decisions on the future. So in IndiaSim, right, we described these different patches that have households and healthcare facilities, and these already have that heterogeneity, right, as well. So our environment is quite heterogeneous here as well, right? These households have different characteristics. These healthcare facilities have different characteristics, as well as just the different areas have different characteristics. And within these households, we also have individuals, and each one of these individuals has different healthcare, has different characteristics. And all of these characteristics, so these individuals' heterogeneous characteristics and their interactions, they are what determine their disease states, as well as some other decisions that they make within the model. So in a particular model, age, gender, nutrition, proxies, and interactions with individuals might define their specific health states. In others, nutrition might be less important. Wealth might be important. So different factors, depending on what we're modeling specifically. If we're looking at a model that is about diarrheal diseases, or if we're looking at a model that is related to diabetes, what those factors are will differ from model to model a bit. But all of these individual characters affect the health state of individuals. And similarly, household characteristics affect care-seeking behavior. Now, in the way we modeled IndiaSim, those are modeled at the household level as opposed to individual level, because the data we had about behavior was at the household level. We didn't have data of how individuals behave, but how household level how households behave generally in terms of where they seek care and whether they seek care in different situations. In the care home model, in the COVID-19 model, we have a heterogeneous care home population that includes residents, not patients, residents, that includes staff, and also there's interaction with the external community. Actually, in a more recent model, which is actually currently under review, we have, this is actually not quite an age-based model, but it's a hybrid agent-based system dynamics model. We have heterogeneous healthcare facilities. So the healthcare facilities in this model are actually agents, as are staff that are working external, that are bank agency staff that work across care homes. The idea behind this model is to understand how staff that work across care homes, because bank agency staff might work one day in one healthcare facility, one care home, and another day another, how they affect the spread of COVID across networks of care homes. So in this case, we have heterogeneous care homes that are making decisions, that are autonomous in making decisions, and bank agency staff that are making decisions. But then within each care home, we have sort of an equation-based compartmental model of how the disease spreads within each care home. So in that case, there's not heterogeneity within the care home, but heterogeneity between care homes and for staff coming in and out of those care homes. One of the key advantages is the flexibility of agent-based models, is also the flexibility to model agents' behavior. So in IndiaSim, an example of that is a care seeking, which is a household level function, as I mentioned. And that's modeled using a logistic regression model for IndiaSim simulations. Depending on the specific disease, we in some cases have this logistic equation. In some other cases, we base it on some more simple if-then type rules. But there's a model that looks at household level characteristics such as wealth, whether it's insured, education level, as well as the distance of the household to different healthcare facilities and the quality of these the perceived quality of these healthcare facilities, since that quality is based off of how individuals view the quality of the healthcare facilities when they make decisions on where they seek care, as well as whether they seek care. So you can see there's a paper from 2013 that was specifically about this logistic regression model. One of the, I mentioned this briefly, but one of the, another flexibility that is very much unique to agent-based modeling is the ability to learn. And that's based off of the idea that we can have that agents can have that memory and remember what they've done in the past. Based off of what they've done in the past, they can change their future behavior. And that's not something that's really possible with other types of models, which it's very difficult to incorporate that sort of memory in these other models. So say an example of that might be, there might be a few different functional forms that describe my decision whether I go to seek care in a healthcare facility. And those might be affected. Which functional form of how I decide to choose whether I go to seek care might depend on how well in the past, when I made those decisions, how well that worked out for me, right? So if in the past I use one functional form to make a decision whether to seek care, and that led to a poor outcome, such as I waited a very long time in line, or I wasn't very happy with the care I got, I might change how I make that decision in the future. So learning over time, agents learning over time, from their historical behavior that they've done, or what historical behavior has led to, is something that we can incorporate. Now, that's not something many agent-based models do, or many models do in general, and there's not something along these lines currently in IndiaSim or in the care home model, because really you'd want to incorporate that if that's important for the specific question you're looking at. It hasn't been very important for the specific questions we've been looking at for those models, but for some other models, you can envision that being something important, trying to see how people change their behavior based on how they learn from past actions and their outcomes. Another advantage in terms of its flexibility is the ability to include diverse sources of data. So IndiaSim, for example, has several different submodels, right? So it has a population model, healthcare provider model, there's disease model, different disease model, models of decisions on getting vaccinated, models of decisions on care seeking, and we saw an example of the logistic regression model incorporated there, and various other models. And as you can imagine, all of these also incorporate very diverse sources of data, as well as diverse sets of expertise. Since then, we can incorporate so much from different areas, it often brings different sets of expertise together into one room to develop these models. So when I work on a model, I usually have to collaborate with other experts in other areas that can say something more than I could about how populations evolve over time, potentially, if it's important for my model to capture that evolution of the population over time. When would that be important is if I say have a model if I have a model that's evaluating an intervention that I need to know the outcomes for over, say, 100 years, then the evolution of the population is important. If I care only about an analysis over 1 week, maybe the evolution of the population is not very important. But all of these different factors mean that I need to have these discussions with experts in various different fields and incorporate knowledge from various different fields. So which tools and software to use? I'm not going to go too deep into this, although we are doing pretty well on time. But one of my main recommendations, and I did not do this for IndiaSim, but we are doing it now for COVID-19. If you're interested in doing agent-based modeling, is taking a look at ODD protocols. So ODD stands for Overview, Design, and Details. And they were developed as a way to report agent-based models. As you can imagine, with mathematical models, with equation-based models, if you understand the maths of them, right, you can quite quickly grasp, all right, what is in this model, what's going on in this model. Since agent-based models are code-based, and often there's lots of lines of code, it's harder to grasp just from looking at the code what's going on in a model. So ODD protocols were first developed to describe in a consistent way what agent-based models, what a specific agent-based model looks like, what it involves, and also to have a protocol that means an agent-based model is reproducible. So if an individual that understands agent-based models sees an ODD protocol of a specific agent-based model, they can, using all the information in that ODD protocol, they can reproduce that agent-based model. So that makes these agent-based models more scientific as well, since reproducibility is a key element of agent-based modeling. I find that it's also helpful to conceptualize models, not just to report on their structure, but also to conceptualize models. At least the first couple of sections, the overview, all of the 3 overview sections and the design section are very useful for conceptualizing models. Starting off with first thinking about purpose and patterns. What is the purpose of my model, and what patterns would mean it is a sufficiently good model for me? And then thinking about what the entities in my model, those are like my agents, and what are the state variables that describe these entities. what that looks like, and then moving on to what the entire process looks like, as well as thinking about the design concepts, which are a list of different design elements that are typically quite important for agent-based models, and it's important for the modeler to think about how their agent-based model incorporates these elements and what it does incorporate from these elements. Not all design concepts are included in all agent-based models, but there are a few that will be in all of them. Emergence will be on all of them. Adaptation will usually be in agent-based models. Sensing will usually be in them. Interaction will always be in them, but some of these are included in some models, like learning, which we talked about briefly, is in some models, but not always. So I find it working through these sections is often used for conceptualizing. Now that's all I'm going to cover here about ODD protocols. So obviously that's very brief introduction to them, but you can look them up. There's several papers about ODD protocols that you can look up if you want to learn more about them. What tools to use to implement your conceptual model, right? So after we develop our conceptual model, in agent-based models, we have to implement that model in some sort of coding language. You can do it in any coding language you want, really. Object-oriented languages are better because there's a lot of relations between agent-based modeling and object-oriented modeling. So it could be in C++, Python, Java, could be in R as well, although, like I said, object-oriented languages are better. IndiaSim was programmed in C++. Now, obviously, needing to learn how to program is a high barrier. So there are also for-purpose environments that simplify the process and takes care of things that you often might not even think about when you first start working with agent-based models. Things such as, right, what order do my agents act in? Right. So if you have a simulation, right, we're looking at individual level. So let's say we have a population of individual and each individual is performing some sort of action, such as seeking care in healthcare facility. Anyone that's let's assume everyone in my population has some sort of disease, diabetes, and they make decisions of when they want to seek care. Now, if every time I go through my population and they act in the same order, there's going to be some bias caused by that fact that they are acting in the same order. Always the same people get care first, right? So things such as randomizing the process of when what the order of actions of my agents is something that is taken care for in these for-purpose environments that you would have to program yourself if you were developing an ABM from scratch in just any coding language. So NetLogo is one coding for-purpose environment, and these are still coding environments. They just simplify some of these processes. But NetLogo is the one I use for teaching. It's the reason I use it for teaching is it's open source. It means I don't have to teach C++ or Python, but it's also open source and free. So you can actually go to the website at the bottom over there and get NetLogo, and they have some tutorials. So you can take a look at that. It's well established at this point. You'll find a lot of literature that has used NetLogo to publish articles in the health space and in other spaces as well. And it's the coding language, I would say, is a bit weird in NetLogo if you've done coding before. But if you've never done coding before, the reason it's a bit weird is it's supposed to be easier for people who have never coded before. If you've done coding in C++ or something like that, then it might seem a bit weird to you, and there might be some things you need to get used to. I'll just mention one more, which is AnyLogic. The reason I mentioned that, it's Java-based, so it's built on top of Java, and you can incorporate Java code in it. But that is what the COVID-19 model. So my PhD student has coded it, and she's coded it in AnyLogic as the main reason I mention it. That one is not open source. It's quite expensive, but there's a free student version which you can use. The visual, so Another advantage of for-purpose environments, if it's important for you, there's a visual interface that shows how the agents move over during a simulation. The visual interface in any logic which is not open source is a bit higher than that logo. There's also several other examples. I know those a bit less well, though. So that's what are the tools that I would use, options for tools that you use for running an agent-based model. But then, like any other type of simulation, what we end up producing is data that would look like similar to what we would see in real world data. So then we would typically analyze that data. That data is for any time interval that is larger than your time step, right? So in an agent-based model and other simulation, discrete time step simulations, you would decide how long a time step is. It might represent an hour, a minute, might represent a day, a week. So the data would be any time interval larger than your time step. It could be at the level of an entity or groups of entities based on the characteristics. So you could have output that is for all males, output that is for all females, output for everyone in a certain wealth with a certain wealth status, or all households of a specific religion, and so forth. Or it can represent your entire population. One thing that's important is that most ABMs, important to remember is that most ABMs are stochastic. So that means that we should typically need to run many simulations before we analyze our data that we produce. Since all the events in them are probabilistic, they happen with some sort of chance. One simulation run is just one instantiation, and the outputs of one simulation will look different from another. So typically when we analyze it, we want to understand what the distribution of potential outcomes might be, and we have to run the simulation many times. From any of the programs I mentioned in the previous slide that I might use for agent-based models, you can typically export the data out and output the data into any sort of file, such as a CSV, and then you would use just any software that you typically use to analyze that data. For me, it's usually I use R, but you can use any software that you usually use. Some people might use Stata, some people might use Excel or some other software to analyze data. Just taking a quick look at so that was just to give you an idea of what are some tools if you're interested in getting into agent-based modeling, and if you've not done them before, that might be helpful for you. Just a quick small subset of some output, just so you get an idea of some of the outputs that we have produced with agent-based models. These are just a couple of pictures from IndiaSim, but I'm going to point you to a list of articles below here to get an idea for more outputs. In IndiaSim, that was part of the DCP project, and we were interested in conducting extended cost-effectiveness analyses, which look at both the impact of interventions on disease burden as well as on financial risk protection. So protecting individuals from going into poverty, for example, because of having significant health events. So we produced outputs looking at outcomes at the state level and produced these maps, for example. And we also looked at rural-urban divide as well as outcomes by wealth distribution. These specific examples here are looking at a few different routine vaccination programs. I'm looking at the impact of introducing a rotavirus vaccine. So this is from a study from 2014 before the rotavirus vaccine was introduced. And also expanding DPT and measles vaccination as well. So this is just to give an idea of what some outputs are. Similarly, for the case of care homes, and I have a list here. I can send the slides afterwards. If you're interested, you could get the slides as well. This is just a few outputs from our care home models. So the one on the left here is looking at different testings or different interventions within a single care home. and trying to evaluate which ones are most effective. There's a set of reference interventions that were implemented immediately in Scotland and in the UK when care homes were first hit with COVID-19. And then we looked at a few different testing strategies as well as other interventions. Most interventions reduced the burden on care homes slightly, but not to a huge extent. Testing staff was by far the most effective intervention. Testing residents was not very effective because staff mediate, or the staff are the ones that have to have contact with patients or with residents within the care home, and they transmit the infection between residents in the care home. So their testing was particularly important. And I don't have an image of that here, but if you look at some of the publications, you can see the more frequently you test them, the far more effective that is. In this specific figure on the left here, in the box plots, this is weekly testing, but if you reduce it further, then it becomes even far more effective. The one in the middle here is looking at the effect of reducing visitors in different settings of care homes, right? So from discussions with care homes over here, and different networks of care homes, we found that staff often live quite near the care homes, whereas visitors might come from a far more broad area. So if staff, so there were advantages to reducing the number of visitors only if where staff lived, the relative number of infections was very low compared to where the rest of the population came from. That's what this heat map is showing over there. And also so this last figure on the right is actually it's from a paper that is not yet published. The other two are published. That one's looking at effective staff shortage versus use of agency staff. So what happens if we replace staff that can't come in potentially because they have COVID with agency staff in terms of transmission across care homes. So those are some of the results, a few of the results. You can take a look at, for both of these, you can take a look at these various papers and reports to see a lot more results looking at different types of questions. Quickly wrapping up, we saw two very different agent-based models. Both are in the space of health systems and disease modeling, but on vastly different scales. So one of them we're presenting, representing the whole population in India, although we do not have 1 billion agents in that one. We represent them with, it depends a bit on the specific model, but with approximately 1 million or so agents that represent the entire population. Whereas the care home model, there's a few different ones there. Actually, there's one care home model that we're just looking at one care home, and that has a model of, depending on which care home we're looking at specifically, but maybe about 80 residents and say 20 staff or something like that, or potentially a bit less. And there's also a model that looks at networks of care homes, but these are far different scales compared to the IndiaSim models. They're intended to answer different questions, and that's important to always build your models, whether they're agent-based models or other types of models, towards the questions you're trying to answer. We saw that ABMs provide flexibility to overcome imperfect assumptions due to mathematical tools by simultaneously considering heterogeneity, behavior, stochasticity, potentially also memory, if that is something that is important for your specific question. That being said, agent-based models also have some negative aspects. I didn't really cover too much of them. They are related to the data requirements to really make them useful, and to the simulation runtime if you have a very big agent-based model, such as IndiaSim. And a key thing to remember is we don't want to have complexity just for the sake of complexity. So we build our models to answer our specific questions and keep them as simple as possible to answer those questions. On when to use an agent-based model, I would say use it when we need that flexibility that equation models cannot really handle well. when our entities interact in non-random ways is one such case, not just for infectious disease, but if they make decisions that are not just random, or that would always be the case. But if those non-random decisions or interactions are important for our outcomes or important to answer our specific question, if model entities with bounded, I would also use it to model entities with bounded rationality. So that have some sort of model that describes how they act, whether it's, so we bound the rationality in some way there. Agents that engage in some sort of strategic behavior, they have some sets of goals that they want, or if they need to learn and adapt their behavior. Also, if we have rich environments and those are important for the outcomes of our model, say if the social network structure is important, if the spatial representation is important, if the entities in our environment co-evolve, so there's some sort of evolution of both our environment and our agents, and they affect each other. But generally speaking, if the context is particularly important and we can model it, it can be useful to use an agent-based model. And of course, when heterogeneity is important for our model. And more broadly, when all of these different factors come together, if we need to model heterogeneity, but also interaction in non-random ways, and our environment is important, not many other types of, well, other types of models, modeling methodologies can't really incorporate all of these elements together. So that was very quick, and a lot to take in probably with such a in such a short period of time. But I'm happy to take questions now. If you want to learn more, you can take a look at that. Learn more where we teach an agent-based model specific class. You can take a look at that MSc as well. But I'm happy to answer some questions now. And I'll open up the chat here.
I wanted to ask about like, so we typically specify some micro level rules for in terms of how our agents are behaving, and that try to produce some data on a global level using that. That's what we are. But how, like, what are the ways we verify that the rules that we are specify are actually the true representation of the agent? Like, is there some way of, yeah, like, so something like there is a like squared error in terms of machine learning or like logistic models or something like that?
Yeah, that's a very good question. So validation of agent-based models can be difficult, and there's some literature out there on how you would validate it. There's a few different methodologies and approaches to validation, and you should probably implement not just one of them. There's what I would call white box validation. If I had to group them into two, what I would call sort of white box validation and what I would call black box validation. You should probably do some of both. White box validation involves potentially that discussion with the specific experts in the fields to make sure that the way that agents are behaving does it indeed represent how they're behaving. And it might mean after you've done your model, simulated your model, you might go trace how your agent, the behaviors that the agent went through over time during your model and specific agent, and show that to someone with expertise in that specific field, whether that field is in some sort of decision science, could be even psychology, and make sure that that indeed makes sense. But also there's black box validation. So those are sort of the things that you might think about in white box validation. Black box validation. So often in say when you're writing your ODD protocol, the first section in the ODD protocol, if you recall, was purpose and patterns. So patterns over there is meant to describe the different patterns or that emerge or outcomes of your model, either at the micro level or the macro level, that you that you think your model should be able to reproduce for it to be sufficiently useful for its specific purpose. So you define what those are at the beginning. Usually you want to define those before, at the point of time before you really start getting into before you actually run your simulations. So you have an idea of what you want to be able to reproduce early on in your project. And those can be patterns that are micro level or macro level. It can be, I want to be able to reproduce these types of behaviors. I'm not within the model, I'm not necessarily specifying that this is how the agent will behave, but they make decisions based on a number of different factors, and that produces some data that says like 10% of the time they make this choice, 20% of the time they make that choice, a different choice, and so forth. You might want to reproduce that sort of, be able to produce that sort of data, or you might want to reproduce population level, macro level outputs. So you specify that ahead of time, and then in terms of what do you then use to validate that you indeed get those outcomes, that's often can be quite similar to what you would do with other modeling methods. It could be visually, you could do it. You could have some sort of mean squared error type analysis, some log likelihood type analysis to try to look at your data that you decided early on in your study you want to be able to reproduce matches, that the simulation outputs match that sort of data. So I would say you should do both sort of white box validation and black box validation, and that's how I group that. Yes, Suraj.
Hey, hi, hello. So I had a question regarding the computational the expense that it takes to run these models or to train these models. So can the agent-based models can be generalized or can be reused for a different kind of problem or context, but from a similar field?
Sorry, so reused for a different. So if they can be reused, I mean, generally speaking, you want to build a model towards its specific purpose, but there are some elements that overlap between one model and another, right? So in IndiaSim, right, we have reused it, obviously extending it in different ways and building on top of one of another, but we've reused it for different analyses. So there's, if I go back a few slides here. So we did some work on epilepsy, we did work on vaccination strategy, we did work on pneumococcal disease, we did work on a home-based neonatal care package, which included ASHA workers and other types of workers, which is not something that was part of the other models. We looked at water sanitation types of interventions. Now, these are all different models that incorporate different elements in them. So you can build it in different directions, add modules that look at things in different directions. You don't really want to necessarily get into a situation where you just keep adding module over module over module, and you end up with an extremely complex model that you don't really understand what's going on in it. You always want to keep it simple enough so you understand what's going on in it. But you can build, if you build it modularly like this, then you can extend it to use some other questions and answer some other questions. So you can extend it to some extent. Could you take this model and then all of a sudden change it into a model about electricity use? And not really, I don't think so. But I mean, there might be a few elements in this model that might be useful for you for that. Maybe the population evolution model might still be important for you, or some elements of that, but most of it would not be important for that model about electricity use, for example. Does that answer your question, Suraj?
Yes, thanks.
I think we have one in the chat box which says, is IndiaSim currently under active development?
No, not currently. So I haven't. So the last project that I did on IndiaSim was on pneumococcal disease modeling and introducing the pneumococcal disease, and I haven't done much on it since then. Potentially will be again in the future. It could be, but there would be at this point things that I would want to update, including the types of data that we work on, since it was based on DLHS data back from 2000 14, or was it? I don't remember at this point, but it's based on some of it is based on older data at this point. So there would be elements that I would want to change at this point. Update. Sounds good. Yes, Anurag, and let me know if I'm pronouncing that wrong.
Yes, it's right. I had one question. During the presentation, in one slide, you mentioned that for the IndiaSim project, individuals were an entity while building the model, right? And as a characteristic for the individual, you considered interactions with other people. So considering that the change due to the COVID scenario, as the interactions between individuals have changed quite a lot pre-COVID and post-COVID. So if we are currently developing, if we have been currently developing a model, say IndiaSim, and those interactions change, so how do we go about changing those characteristics for any entity so that it reflects in the model?
So changing characteristics within IndiaSim, like if you're talking about the types of characteristics, then you would have to code in new types of characteristics. If you're talking about characteristics that exist in the model already, such as wealth elements or wealth characteristics or other characteristics that you just need to change the values of those characteristics, that would just mean uploading new data into the model. So the way that IndiaSim works is you upload these CSV, you use CSV files that IndiaSim essentially loads to start running the model. That data is just, you have it like, there's like 5 or 6, I don't remember, different files. One is describes the population, individuals, one describes the households, one describes healthcare facilities, and each one of them has a list of variables that is then used in IndiaSim simulations, and you would just upload a different data file essentially if you wanted to change the characteristics. If you wanted to change how individuals, how individuals behave, because potentially they behave differently now because of COVID, then that might be then that might involve more looking into developing new behavior models that you would have to code in. That might involve doing some, depending on what behavior you're talking about specifically, might involve also looking at doing some regression models or other types of models that describe the individual's behavior or decisions, specific decisions, for say decisions related to whether they go outside or not, or whether they go to a restaurant or not. Those decisions, you might have to construct some sort of model of how they make those choices, and then you can use the data from a given data file to inform how they make that decision, if it's based on their own characteristics as well as the environment of what's going on in that particular point in time within the model. That environment might describe, say, what is the overall infection number, or the overall infection numbers in the population, or the death rate in the population, plus some of their own characteristics can determine, say, their risk tolerance to going to a restaurant, for example. So you'd have to program that behavior type model into IndiaSim if you're talking about adding new behaviors. Does that answer your question?
Yes, thank you.
Yep.
All right then. Thanks, Itamar, for chatting with us. This was super insightful, and I'm hoping that we can maybe like chat again in a smaller group and see if we can encourage you and help you to resume some of the IndiaSim stuff.
Yeah. Yeah, thank you very much for inviting me. It was very nice talking to you.
Yeah. Thanks everyone for joining.
And thank you for the good questions. All right, have a good night.
You too. Thanks.
Bye-bye.